Imagine being a miner in the 19th century, miles away from civilization, suddenly struck down by illness or injury. What would your options be? Picture this: the unforgiving wilds of 19th century Africa or Australia, a landscape marked by remote goldfields and mines, where rugged miners toiled under harsh conditions. Their quest for wealth was not without its perils. Injury and illnesses were common, and the nearest medical help could be hundreds of miles away. The medical facilities that did exist were far from the state-of-the-art hospitals we know today. They started as makeshift structures, often just tents set up on the edge of mining camps. These were places where the concept of hygiene was a luxury, where equipment was scarce, and where the odds of survival were slim. In such environments, the harsh realities of medical care hit hard. Every cough could signal a deadly disease. Every cut could lead to a fatal infection. The threat of injury was constant, from mining accidents to violent confrontations. And let's not forget the ever-present danger of snake bites or attacks from wild animals. Medical help, when it came, often arrived on horseback or on foot, with doctors and nurses facing their own set of challenges. They had to navigate treacherous terrains, endure extreme weather conditions, and overcome the constant threat of disease. Their resources were limited, their patients critically ill, and their medical knowledge, by today's standards, rudimentary at best. Yet, despite these overwhelming odds, they persevered. They adapted, learned, and did whatever they could to save lives. Their determination and tenacity gave rise to the earliest medical facilities in these remote areas, the nurses' home and the Chamber of Mines. These facilities, rudimentary though they were, represented a beacon of hope for the miners. They were places where pain could be eased, where lives could be saved, where the sick and the injured could find some semblance of care. In such desperate circumstances, survival hinged on places known as the nurses' home or the Chamber of Mines. From makeshift tents to brick-and-mortar structures, the evolution of these medical facilities is a tale of human resilience and innovation. Let's delve into this fascinating journey. In the early days of the gold rushes, the medical facilities were as rugged as the miners they were designed to serve. Picture a sea of makeshift tents, each one a beacon of hope for the ailing and injured. These were the first medical facilities, born out of necessity, operating with limited resources and rudimentary tools. As the gold rushes continued, so did the influx of miners, and with them came an increase in the demand for medical care. The tents soon gave way to more permanent structures. These were often simple wooden huts or shanties, barely more than 4 walls and a roof, yet they represented a significant leap forward. The evolution didn't stop there. As mining communities grew and prospered, so did their medical facilities. Brick-and-mortar hospitals began to appear, replacing the wooden shanties. They were built to last, a testament to the community's growing commitment to healthcare. These hospitals were equipped with more than just the bare essentials. They boasted separate wards for men and women, operating theaters, and even pharmacies. The number of beds increased, allowing for more patients to be treated at a time. The level of care also improved, with more qualified medical staff and better equipment. Despite these advancements, the facilities were still a far cry from what we consider standard today. The resources were limited, the conditions were harsh, and the mortality rates were high. But they were a beacon of hope in a time and place where hope was often in short supply. The evolution of these medical facilities is a testament to human ingenuity and resilience. It's a story of communities coming together to care for their own, of making do with what they had, and of constantly striving for better. As these facilities evolved, so did the quality of care, but it was still a far cry from what we consider standard today. Scene script. Who were these brave souls providing medical care in such challenging environments? What drove them to this demanding work? In the heart of remote goldfields and mines, the people behind the care were a unique mix of individuals. They were doctors and nurses, thrust into the wilds of the 19th century, far from the comforts of civilization. They were the unsung heroes of the gold rush era, their stories often overshadowed by tales of fortune and adventure. These healthcare professionals were a breed apart. Many were driven by a sense of duty, a calling to heal and care for those in need. Others saw opportunity in the gold rush, not in the glint of raw gold, but in the influx of miners in need of medical attention. Whatever their motivation, these individuals faced the same harsh realities of the wild as the miners they treated. Picture this: a doctor, miles from any city, working in a makeshift hospital, often nothing more than a tent or a hut. Their tools were rudimentary, their supplies limited. They faced a host of illnesses and injuries, from infectious diseases to mining accidents. Yet, they persevered, driven by their commitment to their patients. The nurses, often referred to as the angels of mercy, were no less remarkable. They worked long hours, providing not just medical care but also comfort and solace to the sick and injured. Their work was physically exhausting and emotionally draining, yet they carried on, often the only source of care in these remote locations. But let's not romanticize their roles too much. The work was grueling, the conditions harsh. There were no awards or accolades. The miners may have been chasing gold, but these healthcare professionals were chasing something less tangible, but no less important: the preservation of human life. Their work was not for the faint of heart. They faced adversity with courage, determination, and a steadfast commitment to their profession. They were more than just doctors and nurses. They were pioneers, carving out a legacy of care in the wild. Their dedication provided a lifeline to the miners, but the harsh realities of their work were often hidden behind the title of Angel of Mercy. The illnesses and injuries miners faced were as varied as they were dangerous. How did these facilities manage to treat them? In the midst of the gold rush, life in the mines was fraught with peril. The typical health issues faced by miners ranged from the common to the catastrophic. Miners often suffered from malnutrition due to a poor diet, which led to a weakened immune system and susceptibility to diseases. Influenza and pneumonia were rampant, given the cramped living conditions and the harsh weather conditions miners had to endure. The lack of sanitation further compounded the spread of diseases, with typhoid and cholera being common. Then there were injuries. Cave-ins, explosions, and accidents with equipment were an everyday risk. Miners came in with broken bones, burns, and open wounds, often complicated by infection. Now let's talk about the treatments available. The medical facilities at the time were rudimentary at best. Anesthetics were scarce, and surgeries were often performed with the patient fully conscious. The primary methods of treatment were bandaging wounds, setting broken bones, and, in severe cases, amputations. Medicine was a far cry from what we know today. Most of the drugs available were basic painkillers or fever reducers. Antibiotics hadn't been discovered yet, so infections were a major challenge. Many a miner's injury became a death sentence due to the onset of gangrene or sepsis. Yet, it was not all doom and gloom. These facilities, despite their limitations, were staffed by dedicated individuals who did their best with what they had. They implemented quarantine procedures to contain infectious diseases, provided palliative care for the terminally ill, and even conducted rudimentary physical therapy for those recovering from injuries. The survival rate was not high, but without these facilities, it would have been almost non-existent. Every life saved, every miner who walked out of those doors, was a testament to the resilience of the human spirit and the power of medical care, even in its most basic form. Despite the odds, these facilities were the difference between life and death for many miners. These medical facilities served as more than just physical care providers. They played a vital role in the lives of miners and their communities. Imagine the isolation of the miners, far from civilization in the harsh wilds of the 19th century goldfields. The nurse's home or chamber of mines was often the only connection to a semblance of society. These facilities soon evolved into social hubs where miners could share stories, seek comfort, and momentarily escape the harsh realities of their grueling work. The impact on the mental well-being of the miners was profound. Imagine working in the bowels of the earth, in constant fear of cave-ins, gas explosions, and the ever-lurking specter of disease. The availability of medical care, however rudimentary, provided a psychological safety net. It offered reassurance that in case of illness or injury, help was available. It was a beacon of hope and humanity in an otherwise brutal and unforgiving environment. But the influence of these facilities extended beyond the individual miner. They also played a crucial role in the well-being of the broader mining communities. They served as meeting points, places of learning, and even venues for entertainment and social events. They helped foster a sense of community, camaraderie, and mutual support among the miners. This was vital in combating the loneliness and isolation that was a part of life in the remote goldfields. The legacy of these facilities is still visible today. Many of the practices and principles they pioneered, such as mobile healthcare and occupational health, are now standard in modern medicine. They also played a role in shaping the character of the towns that sprung up around the mines. These towns were built on a foundation of resilience, resourcefulness, and a shared sense of responsibility. These are qualities that still define these communities today. So when we look back at the Wild West of healthcare, we see a story of resilience, ingenuity, and the indomitable human spirit.